Okay, I'm going to be inserting this patient's NG tube, starting their tube feedings and removing the tube. So first I'm going to I'm going to start off by inserting the tube. I'm going to check the physician's order. Just hit insert the NG tube. I'm going to identify the patient. All right, by the armband, can you tell me your name and date of birth? Okay, this is the correct patient. I'm going to do hand hygiene. Okay. I'm going to put the gloves on. Okay. And I already have the patient in high Fowler's position. I'm going to occlude each nostril, check for patency. Okay, I'm going to occlude the right nostril, the left nostril, and he is able to breathe through his right nostril. I'm going to occlude the right, and he is able to breathe through the left. Okay. Now I'm going to take my NG tube and I'm going to measure it. Okay. I'm going to place the tip of the tube at the patient's nose. First I'm going to coil it. Tip of the nose, and I'm going to go behind the ear. Okay, once I'm here, I'm going to go down to the xiphoid process. And that is, say about 53 inches. So I'm going to mark that with a piece of tape. Okay, so I have 53 inches marked. Okay, now I'm going to lubricate the tip of the tube with my lubricant. Okay, I'm lubricating about 3 to 4 inches. Okay. Now I'm going to insert the tube. I'm going to ask the patient to touch his chin to his chest, and then I'm going to ask him to swallow. Okay, and I'm going to insert it into the right nostril. All right, put your chin to your chest and swallow. Doesn't advance, but we're going to 53 inches. I'm just going to pretend that's in there. Okay, and then I'm going to secure the patient's tube. Okay. So this is in the patient. Okay. The patient tolerated it well, so we're going to keep it in. Okay. The patient's able to speak, says he feels okay. Okay, and to determine the placement of the tube, we're going to aspirate the contents and verify the pH, and then we'll get a chest x-ray and have the tube secured. Okay, and we're going to attach the tube to suction. According to the physician's orders. Okay, and then I would document the type of tube, the fact that we use the right nair, description of the gastric contents, then we verified the placement with a chest x-ray, and the patient responded well. Okay. And now we have an order to start tube feedings. Removing this patient's NG tube. I'm going to verify the order, which I've done, verify the patient. Can you tell me your name and date of birth? Okay. We're going to go ahead and take your NG tube out. So I'm going to go ahead and wash my hands, put on my gloves. Okay, the NG tube is connected to suction, so I'm going to discontinue the suction. Okay, I have my towel I'm going to place across the patient's chest. Now I'm gonna get you to hold your breath, okay? And I'm gonna slowly remove the tubing. You ready? Go ahead and hold your breath. Okay, I'm gonna dispose of this. You can stop holding your breath. Okay, now I'm gonna clean the patient's nostrils. The wet gauze. Okay, and I'll take my towel from the patient. Now I'm gonna remove my gloves, perform hand hygiene, and document the removal of the NG tube and how the patient tolerated it. Okay, it's gonna be tube feedings. So I'm gonna verify the order ID of the patient. So I have verified the order for the tube feedings. Can you tell me your name and date of birth? Okay. And then, can you tell me any allergies you have? Okay. All right, now I'm gonna hand hygiene, put my gloves on. I already have the patient in high powers. All right, and this patient already has their NG tube. So I'm going to verify tube placement by checking the pH and checking residual. Okay, going back. Okay. Check the pH. I'm going to return the residual. We got 50 milliliters. Okay. Now I'm going to flush the NG tube with 30 milliliters of water. So get my water. Okay. Now I'm flushing my NG tube. Okay, flush it 30 milliliters of water. Now I'm going to take my tube feedings and I'm going to prime the bag. So we're going to shake the formula. Okay. I'm going to hang it. Okay. We're going to prime our tubing. Okay. Now we're going to attach the tube feeding to the NG tube. Okay. We're going to turn the pump that's right here. We're going to turn the pump on, and we're going to start off at a slower rate and then gradually increase to the prescribed rate. So this is going to be a continuous feeding, and we're going to make sure we program the pump to flush with 30 milliliters of water or saline every 4 hours, and then we're going to make sure we check the residuals every 4 to 6 hours, depending on the prescription. We're going to make sure that our formula is discarded after 24 hours. And then we're just going to make sure we always assess the site and the patency of the NG tube. We're going to clean it, needs to be cleaned. And we're always going to, we're going to document that we started the feeding, document the rate that we started it at. And then we're going to monitor the patient's intake and output. Whenever you're giving enteral tube feedings, you can do it via a syringe or via a pump. I have always seen a pump in the hospital, but if you're going to give it via syringe, you're going to hold the syringe and the tube straight, and you're going to pour the prescribed amount of feed into the syringe. You're going to let it flow slowly through the tube, and then you're going to pour the amount of water prescribed into the syringe after the feeding and allow it to flow through to flush the feeding tube. So that would be a bolus. So for a pump, this is what I've always used in the hospital. It delivers the feeding slowly. It can deliver a bolus, but in the hospital, I've always seen it, personally, I've always seen it deliver the insulin slowly. You can set the pump to flush every like 4 hours if indicated, but you would use a pump if the patient can't tolerate the gravity-fed bolus via syringe. And a patient might need some conditions that might require a patient to have nasogastric suction, include poisoning, like drugs or any kind of chemicals, gastroparesis, if they have a small bowel obstruction, or an upper GI bleed.